Welcome back, everyone. Today, we're diving into a story that it just broke this morning. Prime Minister Keir Starmer's announcement that he's abolishing NHS England. Now, you might be thinking, okay, but what exactly ISAS NHS England? Well, it's essentially the administrative body, responsible for running England's National Health Service. They handle everything from funding decisions to setting, strategic goals. As you can imagine, scrapping this entire structure is a huge deal. So we're going to be breaking down a Sky News article today that lays out all the details of this surprise move. And believe me, it's a lot to unpack. Potential job losses in the tens of thousands, a complete restructuring of how healthcare is managed, and of course, a whole lot of political fallout. Yeah, this Sky News article really paints a picture of a system about to be turned upside down. Starmer claims he wants to bring the health service back under democratic control, and that this restructuring will save a fortune through AI and digitalization. But is that the whole story? Or are we potentially looking at austerity measures disguised as reform? I'm really curious to hear your take on this expert speaker. Where do you think this is all heading?
Well, the first thing that jumps out at me is the historical parallel. This isn't the first time the NHS has gone through, a major shakeup. Remember back in 2012 when the Conservative government, led by David Cameron, pushed through their own set of reforms. It sparked a lot of controversy and ended up being widely criticized for creating more chaos than actual improvement.
Yes, I remember that period. There were a lot of concerns about privatization creeping into the NHS, but this time Starmer's government is led by the Labour Party, and they're specifically using the phrase democratic control. It almost feels like a direct response to the criticisms of the 2012 reforms. What do you make of this framing, expert speaker?
It's definitely a strategic choice of words. On the surface, democratic control sounds appealing, right? Who wouldn't want a more accountable and transparent healthcare system? But the real question is, what will this look like in practice? Will it mean more direct government oversight, potentially leading to political influence over healthcare decisions? Or will it involve empowering local communities and healthcare providers to have more say in how services are delivered? The details are still quite vague at this point, and I think we need to be cautious about assuming it'll be a straightforward path to a more democratic NHS.
That's a really important point. It's easy to get swept up in the rhetoric, but the devil is always in the details. And speaking of details, let's dive into some of the specifics laid out in this Sky News article. The article highlights that this restructuring could result in a 50% reduction in staff across NHS England and the Department of Health and Social Care. We're talking about roughly 18,600 jobs potentially on the line. That's a staggering number. And to add to the uncertainty, they're planning to implement all of this within a 2-year time frame. Now, Downing Street claims that AI and digitalization will generate significant savings, around £45 billion to be precise, Neri, and that this will offset any negative impacts. But honestly, that sounds a bit like a magic bullet solution, doesn't it?
I'd say it's more like a double-edged sword. There's no doubt that AI and digital technology have the potential to revolutionize healthcare. We're already seeing promising advancements in areas like diagnostics, remote patient monitoring, and personalized medicine. Imagine, for instance, AI algorithms helping to detect early signs of cancer in medical images or wearable devices that continuously monitor patients. With chronic conditions allowing for more proactive interventions, these are just a few examples of how technology could lead to better outcomes and potentially even cost savings in the long run.
Those are some really compelling examples. It sounds like there's genuine potential for positive change, but I guess what I'm getting at is, can we really expect these technologies to be implemented smoothly and effectively enough to generate those massive savings within such a tight time frame? And what about the ethical considerations and potential risks?
You've hit on a crucial point. Implementing these technologies at scale, while ensuring patient privacy, data security, and equitable access, is a monumental task. It requires careful planning, significant investment, and a robust ethical framework. Rushing the process to meet arbitrary deadlines could lead to unintended consequences. And let's not forget the potential for algorithmic bias, where AI systems trained on biased data perpetuate existing inequalities. In healthcare, these are all serious concerns that need to be addressed head-on, not brushed aside in the pursuit of efficiency.
That makes a lot of sense. And honestly, when you consider that Starmer's team was reportedly appalled by any suggestion of delays or consultations, it does make you wonder about their true priorities. It almost feels like speed is being prioritized over careful consideration and thorough planning, especially when you consider that this announcement comes on the heels of several high-profile resignations from NHS England. Is it possible those resignations were a sign that this massive shakeup was already in the works and that concerns were being raised internally?
It's certainly a possibility. And it raises the question of whether this entire move is truly about improving healthcare and making it more democratic, or whether there are other motivations at play, such as cost-cutting measures.
That's a really interesting point. And it leads us to the bigger question of where this all fits into, the broader political and economic landscape. Are we potentially looking at a shift towards austerity, with the NHS being the first target?
Well, to understand that, we need to consider the current economic climate and the political pressures facing the government.
Okay, so let's delve into that. This Sky News article does mention the upcoming welfare bill, which has been quite controversial. Could that be connected to these NHS reforms in some way?
It's definitely worth exploring. The welfare bill has been criticized for potentially leading to cuts in social programs, and there are concerns that this restructuring of the NHS could be part of a broader strategy to reduce government spending.
It's starting to feel like we're peeling back the layers of an onion here. What initially seemed like a bold move to improve healthcare is starting to look a lot more complex and potentially concerning. Now, I'd love to hear your thoughts on the political reactions to this announcement. The article mentions that the Conservative Party, or the Tories as they're often called, are surprisingly supportive of the concept, while the Liberal Democrats, or Lib Dems, are urging the government to focus on social care reform as well. What's your read on these reactions?
It's interesting to see the Tories, who traditionally advocate for smaller government and less state intervention, supporting a move that seemingly gives the government more control over the NHS. It suggests they might see this as an opportunity to push their own agenda for healthcare reform. As for the Lib Dems, their focus on social care is crucial. The NHS and social care systems are deeply interconnected, and any reform that ignores this connection is bound to be incomplete and potentially harmful.
That's a really insightful observation. It seems like every party is trying to position themselves to benefit from this shakeup, which makes the whole situation even more politically charged. For our listeners who might not be familiar with the UK political landscape, the Tories and the Lib Dems are two of the major political parties in the UK. Along with Labour, which is currently in power, the Tories tend to lean more towards conservative policies, while the Lib Dems are generally seen as more centrist. Okay, so we've covered a lot of ground here, but there's one more piece of the puzzle I want to bring up. The article quotes Wes Streeting, the health secretary, as saying that these reforms represent the biggest decentralization of power in NHS history. But how does that square with the concerns we've been discussing about? Increased government control and potential political interference. It seems like a contradiction.
You're absolutely right. It does seem contradictory. On one hand, you have the abolishment of NHS England, which centralizes power within the government. On the other hand, they're talking about decentralization. So how do we reconcile these seemingly opposing ideas?
It's like they're trying to have it both ways, claiming they're giving more power to the people, while simultaneously tightening their grip on the reins. What do you think is really going on here?
It's hard to say for sure at this point, but I think we need to be wary of any rhetoric that oversimplifies complex issues. Decentralization can take many forms, and it's not inherently good or bad. It all depends on how it's implemented and what specific powers are being devolved.
So how can we as informed citizens cut through the noise and figure out what's really going on?
I think the key is to look beyond the headlines and really dig into the details. What specific powers are being decentralized, to whom are they being given, and most importantly, what mechanisms are in place to ensure accountability and transparency.
That's a great point. We can't just take their word for it. We need to see concrete plans and evidence before we can judge whether this is true decentralization or just a clever rebranding of existing power structures. And, it makes me wonder about the people actually working within the NHS, the doctors, nurses, administrators, and countless others who make the system function. How are they reacting to this news? The Sky News article focuses a lot on the political maneuvering, but what about the human impact of this massive shakeup?
That's a crucial aspect that often gets overlooked in these big policy announcements. The potential for 18,600 job losses is not just a statistic. It represents real people's lives and livelihoods.
Right.
And even for those who retain their positions, the uncertainty and upheaval caused by this restructuring can be incredibly demoralizing.
Absolutely. You can't expect people to provide high-quality care when they're worried about their own futures and the future of the institution they work for. It makes me think of a conversation I had with a friend who's a nurse in the NHS. She told me that even small changes in policy can have a ripple effect throughout the system, leading to increased workload, stress, and burnout. And this is anything but a small change.
And it's not just about the number of jobs lost. The specific roles being eliminated and the impact on the remaining workforce are equally important if we lose crucial expertise in areas like management planning or specialized care. it could have serious repercussions for the quality and accessibility of services.
That ties in with another point raised in this Sky News article, the potential for increased reliance on private healthcare providers to fill the gaps created by these reforms. Could this be the beginning of a slippery slope towards further privatization of the NHS?
It's certainly a concern that many people have raised. The involvement of private providers in a public healthcare system is a complex issue with no easy answers. On one hand, it could potentially increase capacity and offer patients more choice, but on the other hand, it risks creating a two-tiered system where those who can afford to pay receive better care than those who rely solely on the public system.
That's what worries me the most. The potential for inequity. The NHS was founded on the principle of universal healthcare accessible to everyone regardless of their income or social status. But if we start relying more heavily on private providers, we risk undermining that fundamental principle. This whole situation reminds me of a documentary I watched about the U.S. healthcare system. It highlighted the challenges faced by people navigating a complex system with a mix of public and private providers, often struggling to access affordable and quality care. I'd hate to see the NHS go down that same path.
I understand your concern, and it's important to remember that privatization isn't just about outright ownership. It can also happen subtly through outsourcing services, creating financial incentives that favor private providers, or even simply by shifting the public perception of what the NHS should provide. It's a slow and often insidious process that can be hard to recognize until it's too late. That's why it's so important to be vigilant and to hold the government accountable for any decisions that could erode the core principles of the NHS.
So given all these potential risks and uncertainties, is there any hope for a positive outcome from these reforms, or are we destined for a future where the NHS is a shadow of its former self?
I wouldn't say it's all doom and gloom. Remember, we talked about the potential of AI and digital technology to improve healthcare delivery. If implemented thoughtfully and ethically, these advancements could lead to genuine benefits for patients.
That's true, and maybe this restructuring, however disruptive it may be in the short term, could create the space for innovative solutions to emerge, perhaps by streamlining administrative processes and reducing bureaucracy. We can free up resources to focus on frontline care and invest in cutting-edge technologies.
That's a possibility worth considering. But I think the key takeaway here is that we can't be passive observers in this process. We need to engage in informed debate, ask critical questions, and hold our leaders accountable for their decisions.
I completely agree. Our listeners should know that they have a voice in this, whether it's contacting their local MP, joining a community group, or simply staying informed and sharing their views with others. There are ways to participate in this crucial conversation about the future of the NHS.
And it's not just about the UK. Healthcare systems around the world are facing similar challenges. The choices we make here could have ripple effects globally.
Speaking of ripple effects, this whole situation has me thinking about potential long-term consequences that might not be immediately apparent. For instance, what impact could these reforms have on medical research and innovation in the UK?
That's a fantastic question, and one that deserves more attention. The NHS has long been a leader in medical research, thanks in part to its integrated structure and vast patient database.
Right. I remember reading about a groundbreaking study on genetics that was only possible because of the NHS's ability to track patient data over long periods.
Exactly. But if this restructuring leads to a more fragmented system with greater involvement of private providers, it could hinder research collaboration and data sharing, potentially slowing down progress in critical areas.
This is a sobering thought. It highlights how interconnected everything is. One seemingly isolated policy change can have far-reaching consequences in unexpected ways, like a butterfly effect scenario.
Precisely. And that's why it's so important to think critically and holistically about these issues. We can't just focus on the immediate impacts. We need to consider the long-term implications for the entire healthcare ecosystem.
So where does that leave us? We've discussed the potential risks and benefits, the political motivations, the human impact, and even the potential global implications of this massive shakeup of the NHS.
I think we've done a great job of unpacking this complex issue. But the conversation doesn't end here as this story unfolds. We need to continue to follow developments, closely challenge assumptions, and hold our leaders accountable.
I couldn't agree more. And for our listeners, I would say this: don't just passively consume the news, engage with it, discuss it with others. The future of healthcare is something we all have a stake in, and it's up to us to shape it. So, expert speaker, as we wrap up this deep dive, what are some key things our listeners should keep an eye on as the story unfolds? What are the indicators that this massive overhaul of the NHS is heading in the right direction? Or the red flags that should make us worry?
That's a great question. I'd say one of the most important things to watch for is how this so-called democratic control actually plays out in practice? Does it truly lead to more local decision-making, greater input from healthcare workers and patients, and a more transparent and accountable system? Or does it simply become a way for the government to exert tighter control over the NHS while shifting blame for any problems that arise?
Right. It's easy to throw around terms like democratic control and decentralization, but the true test is whether they actually lead to meaningful changes on the ground. What are some other indicators we should be paying attention to?
We'll keep a close eye on the workforce situation. We talked about the potential for job losses, but it's important to look beyond the numbers and consider the qualitative impacts are experienced. Healthcare professionals leaving the NHS in droves or morale and job satisfaction plummeting. These are signs that the system is under strain and that the reforms might be doing more harm than good.
It's like that old saying, happy workers make for happy customers. If the people delivering healthcare are stressed, overworked, and disillusioned, it's bound to affect the quality of care they provide.
Exactly. And on the flip side, if we see initiatives that support healthcare workers, provide them with more autonomy and decision-making power, and foster a positive work environment, that's a good sign that the reforms are heading in a positive direction.
So essentially, we need to be looking for evidence that this restructuring is empowering healthcare workers, not just shifting the deck chairs on the Titanic.
Precisely. And another crucial area to watch is the role of private providers. Is their involvement truly supplementing the NHS and expanding access to care, or is it gradually eroding the core principles of universal healthcare?
For our listeners, that might mean paying attention to wait times for different types of procedures, whether certain services are becoming increasingly reliant on private providers, and whether there are growing disparities in the quality of care received by different groups of people.
It's exactly. The key is to be vigilant and to demand transparency from the government about how they're managing this transition and ensuring that the NHS remains a truly public healthcare system.
This has been such a thought-provoking discussion. Expert speaker, you've really helped us unpack the complexities of this issue and understand what's at stake as we wrap things up. I just want to say to our listeners, don't be overwhelmed by the scale of this change. Your voice matters. Stay informed, engage in the conversation, and hold your elected officials accountable.
Well said. The future of healthcare is something we all have a responsibility to shape.
And on that note, we'll be following this story closely and bringing you updates as they develop. Thanks for joining us on this deep dive.